everybody knows UPS, right?
Brown, right?
Yeah. You are so on point. I full respect. But is UPS in the health security business?
You know, a lot of people don't, everybody I know, if I could see everybody in the room and I asked you, do you love your UPS driver? I bet just everyone in the room would raise their hands, but not a lot of people know that we are also the healthcare supplier of, logistics supplier of choice. And it's a capability that, to be honest, we really leaned into at the start of the pandemic because we recognized that the world was counting on us to be able to deliver not just the household necessities that people needed during the quarantines and the lockdowns, but they needed critical health care. And we thought, we are the best in the business at logistics. We should bring those capabilities to healthcare, and we've been on a mission to be the #1 complex healthcare provider in the world and leveraging our capabilities when it comes to moving things across borders, managing customs and brokerage, which are critical when it's just-in-time deliveries in healthcare. You need to have someone that knows how to get things across borders, has that end-to-end visibility capability for delivery of those packages, because for us, it's not packages, it's patients that are counting on us. And we decided we're going to be the best in the business at this. We're going to take the innovation, the engineering, the expertise, and I would argue some of the greatest people in the world that are UPSers to help deliver that. And today, people may not realize, but we deliver 500 million healthcare shipments, around the world. We have over 150 healthcare companies that we support. That doesn't even account all the patients that we're supporting. So it's a vital part of our business because we know it's a vital part of economic health. If you don't have your health, your people don't have your health, the company doesn't have the health, the economy doesn't have the health, UPS wants to be part of that solution because we think of ourselves as united problem solvers, not just United Parcel Service.
Okay, so it's not just the jacket color.
No, we're all in on this. Healthcare matters, and we're going to deliver the best we can.
That's great. So this just isn't a health emergency response, and it's not because you're banking on another health emergency. This is like a pillar you're actively pursuing.
Yeah, and in fact, it's a part of our strategy to double the size of our business. We're about a $10 billion healthcare logistics company now. We want to get to $20 billion in the next 3 years. And the why is because we recognize that first, it's important to have healthcare equity in the world. It's an important value of ours. We want to be part of the solution to helping those countries and communities that don't have the best access to healthcare, finding ways to close those gaps, and logistics is always part of that solution. But we also see opportunities to be able to help governments lower healthcare costs with the rise of at-home health. We want to be part of helping companies that have new innovations be able to get them to more people around the world. We also want to be part of helping develop the next generation of innovations. So a lot of people don't realize we're at the center of some of the most important clinical trials that are happening around the world because we're involved in the logistics and delivery of those clinical trials, the specimens, and all the different elements that go into the research and development of the next generation of healthcare solution. We want to be at the center of that because at UPS, we're really purpose-driven. We want to move our world forward by delivering what matters, and healthcare matters, not just for you and I, but for global health.
And so one of the lessons learned of the pandemic, and a few folks have brought it up, at least for Canadians' perspective, was that, the border really thickened, and, that presented challenges in terms of accessing masks, accessing vaccines, and other necessary, medical devices and equipment.
PPE, right?
Yeah,
the
PPE,
masks, the basics.
Exactly, to meet what was this challenge of the pandemic. So, what is UPS's perspective on that, and what was your role in navigating, what I would think would have been much more challenging set of circumstances than you were experiencing prior to the pandemic?
It was, well, for me, it was life-changing. I don't think I've ever worked more 20-hour days in my life because we were trying to keep supply chains moving or standing up new supply chains. Like when we mentioned PPE, there was a shortage of supply of PPE. We had to figure out, using some of our existing customers, how to stand up completely new supply chains, working with companies like Hanes that were producing T-shirts in Guatemala and getting the fabric from India to figure out how they could retool their manufacturing lines to make not T-shirts but hospital gowns or masks. And so it was every minute of the day thinking about how we had to overcome some of the restrictions that governments were putting into place. And that was the sad part of the pandemic. I mean, on a certain level, we were all in this together, and yet governments took very nationalist perspectives. We had over 50 countries put in place more than 200 different restrictions at the border. And my team's role within UPS was to figure out how to, one, leverage the relationships that we had with those government officials to knock down those barriers or figure out ways to get things moving again so that the costs wouldn't skyrocket, and sadly they did, but the trade could keep moving, and the trade particularly in those critical products that were needed to help people stay healthy or help people that were sick get back on their feet again. And so we saw so many restrictions, from customs restrictions, lack of clearances. Sometimes, customs officers weren't even showing up at work, and so even if you had all the paperwork ready to go, you didn't have a human being to clear it. And there were also restrictions on the movement of people. And people don't realize, you can get things across the border, but you got to have the people flying the planes, driving the package cars or the trucks, and loading those packages into both of those kinds of assets. And there were so many restrictions put on just the basic movements of our people that we had to work local, state, federal, national level government officials to explain to them, we can get it to where you need it. We just need to have the people going with it. And so it was an incredible learning lesson about all the different ad hoc measures we had to negotiate in every single trade lane to keep things moving. And we succeeded in the end. I would argue that the incredible pace with which vaccines were developed, because remember, we were involved in those clinical trials with some of the big vaccine manufacturers in developing them to see if they would work, and then rolling them out and delivering them everywhere. That took a lot of ad hoc measures, stitched together so we could get things delivered, and then advocating for that healthcare equity, because we also as a company said, we'll deliver it to the countries that have these orders in place and have negotiated these agreements. But in our view, the last shall be first, and we were also trying to figure out how to get it to places in sub-Saharan Africa or less developed countries who maybe wouldn't have the political clout or power, but we wanted to make sure we were delivering there too. So incredible lessons that we learned in that process that we're now trying to take from ad hoc measures to a policy framework that we can count on today and in the future, whether there's another healthcare crisis or whether it's just regular operation and business that we want to keep healthcare products and medical devices flowing. So great learning experience, and one that we're trying to capitalize on now to make more solid for the benefit of the health of people around the world.
Well, if you read the U.S. strategy on health security threats,
yes,
climate change is one of the sources of those threats, right? So it's
true.
not just infectious diseases that we may need to fend off. But tell me more about how UPS is trying to embed the learnings of the pandemic and how to, maybe make supply chains more resilient to these sudden shocks because they don't seem to be black swan events anymore. They seem to be much more common.
Yeah, in the healthcare space, time is of the essence, especially for some of these critical in time products that you have to deliver. And so we don't want to be in the situation again where we're having to do the ad hoc negotiations and trying to navigate all these barriers. So what we're doing about it right now is we've created an alliance with great companies, Pfizer, Abbott, Gilead, to create a trade alliance to advocate for legislation in the United States for Medical Supply Chain Resilience Act. And that is basically looking to codify a lot of these measures that allowed us to keep medical supplies moving during the pandemic. And it's got bipartisan support. The greatest legislation that you can pass is when, no matter what party you're from, you support the initiative of trying to create this kind of clear framework for the resilience of healthcare supply chains. But we're also advocating for that internationally. So I currently serve as one of the 3 ABAC representatives, which is the APEC Business Advisory Council, and we're partnering with all the member economies of APEC to also codify a lot of the ad hoc measures that were used to move healthcare products across Asia and Latin America, making sure that there's agreement at this regional multilateral level for this kind of framework, because we think then that sets a very good foundation for streamlining trade in these important products. Because we want to bring the cost out of the system. With so many governments grappling with rising healthcare costs and some of the costs associated with logistics, if we could take some of the barriers out of it and create more certainty in those trade lanes, we can be helping get the products to customers, aka patients, need in time in a more efficient way. And by the way, you raised it, with lower emissions too, right? All of that is a win-win-win. And if we can be part of those kind of win-win-win outcomes, I think that is good for our company and I think good for the world. And so in that regard, we're really hoping that the Canadian government can look at creating similar parallel legislation, because Canada is also a member of APEC, and there can be a couple of anchor countries that show this is the way forward for ensuring that there's resilience in healthcare supply chains. And so we're continuing to advocate that way with healthcare partners in the industry.
That's fantastic. And you know, one of the consequences of every pandemic is amnesia. Like, we all just rather forget that it happened.
I do not have amnesia. I am like, oh, I have PTSD, man.
Right? But so many, you know, businesses, workplaces, governments, they just want to look forward and not look back. But, you know, we have some great business leaders in this room today. You know, what is your message to them about, you know, pandemic lessons learned and about the importance of public-private partnerships?
I was going to say the key is partnership, partnership, partnership. We need to have more collaboration across industry sectors to ensure that supply chains are resilient, more ability to ensure that nearshoring is supported so that there are, when there's challenges, maybe not because of governmental restrictions, but think weather or other kinds of challenges that emerge when you think about some of the Red Sea challenges with movements of containers. You want to have that flexibility that we've built into how our network's set up, but you want that established around the world. And so partnership is the name of the game. Partnership with governments, partnership with companies, because through that public-private partnership, I think we can build in more resilience. And I also think that the future of healthcare is going to move to more home health options, and logistics is going to be critical for that. There's been a fabulous study done by the Commonwealth Fund that talked about the fact that there's going to be 8% growth in healthcare by 2030, and a lot of the opportunities that are going to exist to drive better health outcomes at lower costs are going to come with home health solutions. We want to be a part of that because we think it'll drive a healthier planet, a healthier, global environment. And at the end of the day, that's going to be great for UPS. And so we want to see more recognition of the policy environment that needs to be shaped. And we do that honestly together as companies, working with governments, working with public health officials to ensure that we're working together for the same goal. And I'm hopeful about the future in that regard. We've lived through this pandemic. We've learned our lessons. Now we just need to make them the framework and the foundation from which we build better. So.
All right, thank you so much. You've thrown out a challenge to the room, and hopefully it's challenge accepted. But we really appreciate UPS's advocacy and for everything that it was able to accomplish during such difficult times. Thank you.
Thank you, Jody.
Please join
Thanks,
me.
everyone. I really appreciate it. Thank you so much.
Laura, thank you so much. That's fantastic. Let's bring Melinda Richter, the global head of Johnson & Johnson Innovations from JLabs, one of our sponsors. Great to have you. And Jody, back to you.
Thanks so much. Hi, thank you.
Wow, that was a great discussion. You forget how many people are touched by healthcare or who have a hand in healthcare. So thank you to Laura for bringing that to the forefront.
Yeah. And I mean, I think when we think about health security, zeroing in on that, I mean, everybody knows Johnson & Johnson, right? It's Tylenol, it's Band-Aids, it's medical devices, it's the pharmaceuticals we depend on. But is Johnson & Johnson also in the health security business?
We are, but let me take a step back and talk about our legacy of serving patients for the last 137 years. And that will lead into our mission around health security. So we've been able to serve patients for the last 137 years because we always believe that the best science and technology should become the best solution for patients all over the world. And if we believe that to be true, we also have to be humble enough to say the best science and technology is just as likely to come from outside the walls of a big company like J&J as inside. But when it's out there in early stage companies, well, those early stage companies face many more hurdles to get that concept, that idea, that technology to market than a big company does. And so many times, best science and technology fails. Not because it's not the best, but for other reasons. So at J&J, we believe that it is our responsibility to help all science and technology. So we locally embed ourselves in innovation ecosystems around the world with the express intent to find the best and nurture and accelerate it to get to patients. So how do we do that? Well, we have this organization called Johnson & Johnson Innovation. And we have 3 different components to it. One is JLabs. So we have different JLabs all around the world. And what we do is
including here
in Toronto. You should know I am a dual personality citizen. I'm Canadian and American. And it was really important for me when I started JLabs in 2012 in San Diego. We quickly grew all around the world, but one place I knew we had to have it was here in Canada because of the rich talent and resources that existed here. And so what do we do in places like Toronto? We do educational programs, networking events, funding series. We look for the best companies. We bring them inside JLabs. We give them mentorship, insights, resources, and we accelerate their growth to patients. And then we also have an early innovation partnering team. We have one in each region around the world, and what they do is they can work with the companies to do collaborations to prove out their science and technology. And we also have a corporate venture arm called JJDC, where we can invest in these companies. Now, JLabs exists all over the world. We have almost 1,100 companies now. And those companies span the different sectors of J&J. But most importantly, those companies, since our inception, have done over $115 billion worth of deals in financing. $115 billion.
Those are bees.
Remarkable. Yes, those are bees. And what's good about that is it's not just us doing these deals with these companies. We are a no strings attached model, so anybody can do deals with these companies, and as long as they're reaching patients, that's what we care about. We're no strings attached for that reason. Now, along the way, we hope to get to know the companies better so we can potentially do deals with them as well. But the whole goal is to accelerate innovation in healthcare because it is so hard. Yeah. And so with that, our early innovation partnering teams have done $1.2 billion worth of deals across 600 companies, and JJDC has done $3.5 billion worth of deals across about 100 companies that are under management today. So we have a long history of collaboration, and that's how we serve patients. So coming back then to health security. So 2017, BARDA invites us to a meeting. They want to meet with us. BARDA is part of the U.S. Health and Human Services Department.
Just to help folks who don't otherwise know it, because we do not have such an agency here in Canada, it is the Biomedical Advanced Research and Development Authority in the U.S.
Thank you very much. We need acronyms, right? Yeah, so they're a large organization that focuses on medical countermeasures for future health security threats. Now, those could be biological, radiological, nuclear, chemical, or they could be pandemics or epidemics. They could also be natural disasters. So they're there to plan and prepare for all of them. So they're a very large, powerful organization within the U.S. Department of Health and Human Services. So they requested a meeting with us, and I was like, what can we do for you? Why do you want to meet with us? And it was very interesting. This is 2017, mind you. They showed me a video of how a pandemic could spread around the world in days. And you know what I said? I said, you're crazy. That is never going to happen. Yes, hindsight.
If only that were true.
Yes, exactly. So they said to me, listen, we're a huge government organization. Only big companies can afford to actually do a deal with us. It costs, they said they did the math, it costs about $1 million to negotiate a deal with BARDA.
Wow.
And so they said, we're not getting access to the best science and technology in all these early stage companies because of that. So can we partner together and you be the front end source, bringing in innovations that could actually address 21st century health security threats? And what we can do is put together this program where we're doing the same sort of things that you're doing at Johnson & Johnson Innovation, doing educational events so people know what the next generation of threats are, what are the mediums that are needed to address these threats, and then how do we start moving those companies forward. And it was very innovative of them to come to us and say, how can we do this together? So it was something that took a couple of conversations with corporate, but then together, BARDA and J&J came together in 30 days and did an agreement.
30 days.
30 days. Talk about two very big, maybe slow, organizations and coming together in 30 days because of the mission. The mission was so important, and we didn't even know yet how important it was. And so what we did is we came together and created this program called Blue Knight. And Blue Knight was about funding this new kind of incubation, acceleration program that was about anticipating the next generation of health security threats, to activate the global innovation community to address those threats. And as we addressed those threats and we saw which ones would work or not, then we would take those solutions and amplify them around the world. And so we got started in 2019. Little did we know that COVID was around the corner. And so we started off in Washington, D.C. in our new J Labs there at the old Walter Reed Medical Center. And so we started, doing programs and recruiting companies, and all of a sudden COVID hit. And we felt COVID like BARDA felt COVID. And listen, BARDA is an extraordinary organization. The expertise within that organization is second to none. And so together, what we do is we look for companies, we'll screen them together, and what we do is we look for companies that can have a dual purpose, that they can not only provide a pandemic preparedness response, which could be a detection, diagnostic, vaccine, treatment, et cetera, but it also would have a commercial application so that it is something that can stand on its own, create economic wealth, create value to the healthcare system. And so we were looking at all these things together and choosing companies, and suddenly COVID hits. While we pivoted immediately, and we took all the funding that we had for operations, and we turned it into surge funding for those companies. And those companies were working on really pivotal things. In fact, one of them is here called Specific Biologics. So they're working on gene editing for cystic fibrosis. And so we turned that into gene editing to deal with respiratory diseases that come from infectious diseases. And so it was a remarkable way to move these companies forward. And part of what happens then is BARDA funds the program, but they fund the companies to be in JLabs. But if they need the surge funding, then BARDA will allocate certain dollars that go towards that, or to Quickfire Challenges, our crowdsourcing vehicle. And so we quickly pivoted and moved those companies forward. We did some Quickfire Challenges for specific technologies they were looking for to help with pandemic preparedness. And so over the course of time, they would not only look at these technologies for what they could do in the market, but it's all about learning, right? So all around the world, we now have expanded this to be a global program. As we look at science and technology, we're all learning about what the possibilities are, and not just for health security threats, but for technologies that could leapfrog us into the future and take us away from some of those very challenging moments that we had in 2020, 2022. So it's been a remarkable program.
Oh, that's amazing. So I just want to pick up on two things you said. So one is, so even though this is BARDA, which is a U.S. institution, JLabs is global.
Correct.
A Canadian company received some of this funding to accelerate its ideas and innovation.
That's correct. So we can fund those companies to be almost anywhere. There's a couple of countries we can't.
Sure.
I won't name them, but yes, we can have them anywhere. So when we think about some of the challenges that happened with COVID, including, let's say, everybody getting nationalistic and closing their borders, the fact of the matter is we're looking for technologies in all these countries. And so it really is an opportunity for us to say, how can we share, what BARDA is seeing in those countries that they think has promise to protect all of us, and not just protect all of us, but those companies grow and create jobs, and those people go home at night and they feel so proud of what they're working on. So there's so many benefits to it. And as you heard earlier from Laura, it touches so many different industries. Life science sector actually has a multiplier of, I think, 9 when it comes to economic development because of all the different service sectors that it touches. So it is a really great investment, not just for our health security, but for the economic wealth of a country.
Yeah. And the other thing I wanted to unpack is just, what is the value of the public-private partnership in this? Like, is this, what would it look like if JLabs were trying to do this on its own? And you've already talked a little bit about what it looked like for BARDA, like, cost prohibitive for young companies to actually work with them.
Yeah.
So what is that magic in the private public partnership that you're bringing to the table?
Well, so first of all, again, the expertise that comes from BARDA is not something you can find in a textbook anywhere or in an academic institution. That institutional knowledge is unique to them and to experts in the field. And so what happens is we work a lot with them to understand what their strategy is. Yeah. And then as we're looking at their strategy, then we turn that into programming that helps bring the community together to talk about those threats and potential solutions that they're looking for. And then as we jointly choose companies, each of us gives the company a mentor. So BARDA will give them a mentor who connects them to other people within the Department of Health and Human Services, they'll give them access to funding, they'll give them access to other funding mechanisms, and their resources. And on our side, we give them access to expertise in R&D, in commercial, in resources. We'll give them a JPAL that says, let's design your next killer experiment. Here's the data you need to look for, and that will help you get funding or a corporate deal. So together, we put a lot of expertise into these companies. Actually, what's remarkable is these companies in the last 4 years, we've only chosen about 10% of the companies that have applied. So we only have about 46 companies at the moment. But those companies have done over $1 billion worth of deals in the last few years alone. And that's from other people funding. So BARDA brings their economic wealth and experience to the table. We bring our global expertise and our R&D and commercial experience to the table. And those companies, they just need that funding to get started from BARDA. But then after that, that's validation. I mean, that's credibility for these companies. That's funding in the bank from other players, venture capitalists, foundations, non-governmental agencies. So it is an important element that these companies get from BARDA.
That's fantastic. And, it's come up a couple times in some different conversations, this sort of the US-Canada, potential for collaboration around the life sciences. We heard the governor from Illinois talk about, their emphasis on life sciences. We heard it mentioned last night too, right? Like auto, like rare materials, semiconductors, those types of things. What's your perspective on that? What would you see as additional benefits? Like you have this good thing going with the Blue Knight program and it's achieving a health security purpose, but how could we grow that? How can we amplify that? Where's the potential in further collaboration?
Well, I think we've just started. We have our collaboration with BARDA. We bring them companies from all over the world, but we should be connecting in to all the other players within for example, the Canadian government and how we can work together and share information and share technologies. I'm happy we did an impact report from our Blue Knight program that we could share all the listing of our companies, of why we've chosen them and why they're important to us. So there needs to be a lot more collaboration in terms of sharing information, or can be. But also these companies, if you want to find companies in your own backyard, which we should, so that you should think about every country trying to be as independent as possible. Yes, we want to collaborate, and we want to collaborate so we can all be interdependent. And so I think there's a way for us to come together and share how we put together the Blue Knight program, how we work together with BARDA, how that can happen, across the border with, a Canadian agency that might look and feel like BARDA.
Yeah, for sure. It's certainly been something that's been talked about for a great many years. One of Canada's great strengths is its health research enterprise. Melinda, thank you so much for sharing your thoughts on innovation. It's such a fabulous perch, and how we're already collaborating and having so much more potential to do more. Thank you so much.
Thank you for having me.
Thank you, Melinda.